Joining us this morning for a dose of today's health is Dr. Willey from Physicians Immediate Care, and today we're talking Band-Aids, when you should use the little bandages and when you shouldn't, and when the Band-Aid concept should be applied to your overall health. Well, thank you very much for stopping by this morning. First off, you were saying that Band-Aids kind of have been getting a little bit of a bad rap.
You know,
lately.
I think they have. And I brought a prop.
Okay,
Vanna
so
White
example
here.
Band-Aid.
I was worried about my hair in the wind. But anyway, prop here. You know, Band-Aids tend to have a bad name in medicine, especially for complex, hard problems.
Right.
We treat something simply, or we suggest something small, or just use one medication instead of 5, and people will say, oh, that's a Band-Aid solution.
Okay.
Very negative connotation. But I want to talk about the benefits of these guys.
All right.
And any parents out there can tell you the benefits of these
Right.
guys. How many times have these kept my kids playing, or me doing the dishes after I cut myself like I do every time, tell my wife I can't do it anymore. But we can keep in the game, we can keep doing stuff with little Band-Aid solutions. And my argument today is, why not Band-Aid solutions for complex problems?
Okay.
We tend to have a real fear or a real disconnect because we think complex problems require complex solutions. So diabetes, obesity, heart disease, they're going to take all this stuff, all these interventions, all these medications, these surgeries, complex solutions for a complex problem. But I want to back up and say, what about a Band-Aid?
So what about starting simply, basically?
Start simple. For obesity, for example, that's what I deal with a lot. Rather than changing someone's eating habits, getting them exercising, getting them up early, changing everything about their lives, a real complex solution, why not start with the Band-Aid solution? Stop eating after 7 o'clock at night.
So start, like we said, simply.
Add 15, 20 minutes of walking a day.
Okay.
Stop sugary drinks. Pick a Band-Aid that you think you can do, apply it, and once that wound heals, get another Band-Aid out and do it again.
So keep moving on down the road kind of thing.
Exactly. And that's really what I want to focus on is Band-Aid solutions may be our solution for these big complex problems versus approaching them with so much as we try to do. Because, you know, we're getting close to March here.
Right.
The gyms are going to empty out in the next couple of weeks.
You see who's left at this time.
Exactly. People are in there working
Right.
their behinds off. They've changed their lifestyle. They changed their eating. They changed their schedule. They're exercising hard. Maybe they're not getting the changes they'd hoped for because they did such a complex solution for a complex problem. Back up, maybe stay in the gym, or like I said, stop the sugary drinks. Quit eating at night. Cut out your carbohydrates early in the afternoon. Pick a Band-Aid solution for that complex problem.
Okay, so, you know, it's like you were saying with obesity, you know, pick like a sugary drink or something like that. You know, even beyond that, what would be the next step? So you've picked this first Band-Aid, that's succeeded or maybe failed in some cases. Where should you go to next, I guess?
That's actually, you know, I would say it depends on where your wound is. Obviously, if I have a big cut across my forehead, I want a skin-colored Band-Aid, not a Scooby-Doo Band-Aid.
Right.
That's very obvious. Same thing with this case. If you fix that sugary drink problem, what's the next problem you think you can address? Maybe it's getting up 30 minutes earlier every day to prepare your food.
Okay.
Maybe it's not eating after 7 o'clock at night. Find one that works for your lifestyle, not one that you think is necessarily best for you.
So not necessarily always like the perfect solution or the best or the right solution.
Pick the right Band-Aid for the problem.
Okay, the appropriate solution would be the better way to put it.
It doesn't have to be complex for a complex problem. Make it simple.
All right, well, thank you very much for stopping by this morning.
Thanks for having me.
And still